The irony is, as much as the patients want the treatments, they need to participate in the research to make the treatments possible.
Any of the patients that we see in clinic, and many of them are very interested in clinical trials, we're like, genetic testing is always the first step. It's always the first step in knowing more about your condition and the potential to help you move forward.
Good morning and good afternoon. A warm welcome to our wonderful guests and anyone watching or listening to the new ProCure Talks discussion series. My name is Andy Boland. I'm the Associate Director for Patient and Medical Community Engagement at ProCure. Through these short conversations, we're aiming to break down some of the tougher, denser topics, which are always a challenge to communicate. Firstly, let me come to our guests, Kerry Branham and Ben Shaberman. Kerry, how are you, and is it feeling as much the end of summer in Michigan as it is here in the Netherlands?
It is very much. I'm very well this morning, and I'm excited for fall to come, excited that the weather is a little bit cooler. I could do without the overcast, rainy kind of weather that we've been having, but I appreciate the cooler coming of fall.
Yeah, excellent. And Ben, how are you and the view from your window?
I'm doing well, and the view from my window, we're having a downpour here in Washington, D.C. So even though I'm several hundred miles from you, Kerry, it sounds like we have very similar weather.
Across the continent, the rain is falling. Well, here in the Netherlands, we've had an awful lot of it in the last few weeks. But right, let's get to it. Today, we will be looking at empowering the inherited retinal disease community with knowledge of their genetic diagnosis. Kerry Branham is a clinical assistant professor and genetic counselor at the University of Michigan Kellogg Eye Center. She's worked as a genetic counselor at the Kellogg Eye Center for nearly 18 years. In this position, she provides clinical genetic counseling for patients affected with inherited retinal diseases, pediatric eye diseases, and other inherited eye conditions. Kerry is also involved in several clinical trials for inherited retinal diseases. Ben Shaberman is the Senior Director of Scientific Outreach and Community Engagement at the Foundation for Fighting Blindness. For more than 15 years, Ben has been reporting on retinal research for all of the Foundation's electronic and print publications. Ben also enjoys working with constituents one-on-one to help them understand their retinal disease and the research underway that may benefit them. Ben has also written and published Retina Boy, an adventure story which follows a boy from Des Moines born without retinas. Ben writes, Retina Boy is a homage to those who persevere and thrive despite having few treatments or cures for their vision loss. Their courage, resourcefulness, and resilience have been incredibly inspiring to me. Well, welcome both of you. Thank you very much for joining us today.
Thanks for having us.
We'll dive straight in. Ben, coming to you first. Very simply, what is a genetic test?
Just about everyone with an inherited retinal disease, whether it's retinitis pigmentosa, Usher syndrome, Stargardt disease, there's one gene that's mutated that's causing their disease. And a genetic test is performed to try to identify that mutation or that defect in that specific gene.
Wonderful. And Kerry, why is it important for people with an inherited retinal condition to have a genetic test?
So generally, there's a couple of different reasons that we think about why a patient would want to have a genetic test done. One, in some cases, the diagnosis may not be exactly clear. Sometimes that can help to confirm the diagnosis. Sometimes it is also useful for understanding the inheritance. Genetic eye diseases, such as these inherited retinal conditions, they can run in families in many different ways. Sometimes you'll see many generations of the family affected. Sometimes you'll just see an individual affected. But you can't always understand completely what is the risk to other members of the family just by looking at family history. So genetic testing can help kind of confirm that inheritance pattern. The third reason is we know that there are lots of treatments that are being developed for patients that have inherited retinal diseases. A lot of the treatments that are being developed are targeted specifically at the level of the gene, meaning if you were going to receive a treatment for those conditions, you'd have to know exactly what the genetic basis was, what was causing the condition in that particular person.
Wonderful. And I guess building on that, Kerry, how does a genetic test work if someone was to go get one?
Yeah, so you can really think about how someone gets a genetic test on several different levels. At the level of the patient, it's really logistically getting a sample, sending it to the genetic testing lab. The lab will analyze those results and send them back generally to the clinician who ordered the testing. There's varying levels of complexity in there, though. One of them is actually identifying the clinician who may order that genetic test. Not all ophthalmologists are necessarily familiar with genetic testing. There's also the other consideration of the payment for the test. Traditionally, it was that a patient or their insurance would always be responsible for the cost of the testing. We do have some other options now. I'm sure that Ben's going to talk a little bit more about some of those options that patients can get genetic testing done at no cost. So really, getting a sample, usually blood or saliva, sending it to the lab, but you do also have to have those other aspects of it. Who's going to draw the sample? Who's going to consent the patient, talk to them about the test, and how are they going to receive the results of that testing?
Super. So I guess, Ben, coming to you, what should one person do to get a genetic test? I mean, in the US, for example.
Sure. And thanks, Carrie, for referring indirectly to our genetic testing program. So a patient needs a clinical diagnosis of an inherited retinal disease to order a genetic test. And there are many ways to order a test through different companies and vendors. The Foundation Fighting Blindness in the US has a program with Blueprint Genetics to offer no-cost genetic testing to any patient in the US that is diagnosed with an inherited retinal disease. So again, that clinical diagnosis is the first important step. And the test can be ordered by an MD, and in many states in the US, an optometrist. So it's a normal office visit. And as Carrie mentioned, generally speaking, the patient just spits in a tube, and the physician sends that sample off to the Blueprint Genetics lab, where the DNA is screened to try to identify the mutated gene. And then in about a month, in our program, a result will come back to the doctor. And we also provide no-cost genetic testing. If the doctor or the clinic has their own genetic counselor, that's fine. We offer the counseling as well. And the counselor will help explain what the results mean, whether that mutated gene was identified or not. And currently, in about 2/3 of cases, the test will reveal the mutated gene. And in another third of cases, it may be unclear and it may warrant further discussion or testing sometime down the road. And that's what the counselor can really help with. So folks like Carrie, who provide genetic counseling, are really critical to the process, to helping the patient and the family understand what the results mean, and then thinking about the path forward toward a potential treatment.
Super. It should be noted for anyone watching or listening, if you would like to know more about getting a genetic test in your location, which might well be outside of the US, because we are talking about the US here, please talk to your treating physician or write to us at procure.com. We're happy to try and help in any way, shape or form. So Ben, just building on that slightly, applying this knowledge of someone's genetic condition, how does someone knowing their genetic information help research?
So as we all know, there are many great treatments that are moving into and through clinical trials. Clinical trials are essential to getting these treatments across the finish line. But inherited retinal diseases are rare. So recruiting for clinical trials is challenging. And you need really as many people with a genetic profile that's been identified. We need to know what mutated gene is causing their disease to qualify for many of these clinical trials. A lot of the trials are for gene therapies or for RNA therapies like ProCures, or even a CRISPR-Cas9 gene editing therapy. So again, for all of these approaches, the patient has to know what their mutated gene is to see if they're appropriate candidates. And without enough patients in these trials, we can't have a successful trial. So the patients, the irony is, as much as the patients want the treatments, they need to participate in the research to make the treatments possible.
Absolutely, and empowering someone to have their genetic knowledge and then getting them into research is really what we're trying to do. So, Carrie, as someone who is conducting clinical trials, would you have, for someone who doesn't have their genetic information right now, what would you say to them? Would you urge them to get involved so they might join a clinical trial in the future?
Yeah, absolutely. We really think that any of the patients that we see in clinic, and many of them are very interested in clinical trials, we're like, genetic testing is always the first step. It's always the first step in knowing more about your condition and the potential to help you move forward. So we kind of advocate for that, and working with their clinician, or it can also be sometimes we're really talking to ophthalmology clinics, so talking about our ophthalmologist ordering the genetic testing. There are genetics clinics who just deal with genetics in general that can sometimes work with ordering tests as well. But really getting that genetic test is the first step in moving forward and understanding more about any sort of clinical trial that's going on. And part of the kind of challenge, especially if we look at the conditions for which there are clinical trials now, some of them have very distinct ways that people are affected, but there's a lot of overlap. So we can't necessarily see a patient and always say, oh, this is the genetic cause of disease. Sometimes that can happen, but for many patients, it's not. And you're only going to get at what is the cause of the disease, what trials might they be eligible for if you do that genetic testing.
Super. And I guess building on that a little bit further, Carrie, genetic counselors also play a really crucial role in a person's genetic diagnosis journey. Can you briefly tell us kind of what does a genetic counselor do and how do they fit into that kind of wider testing process?
Yeah, so most genetic counselors really work as a part of a healthcare team. So, for example, at our center, we have the ophthalmologists, the genetic counselors, the electrophysiologists who are performing the test, all working together to treat and manage patients that are affected with inherited retinal diseases. Other clinics may have a similar setup to what we have, who see a lot of patients with inherited retinal diseases, whereas in some patients, it may just be the ophthalmologist and they will work with a genetic counselor. So anytime that a patient is seen for genetic counseling, we will get complete medical history, family history information, and then after the diagnosis is confirmed, help the patient to understand what is the likely inheritance, what are the options, how can we go about doing genetic testing. Once we get the genetic testing results back, it's really explaining those genetic testing results. Sometimes the results that we get back from a genetic test are really crystal clear, meaning the answer is clear, we understand exactly what the genetic cause is, whereas in other patients, it may not be so clear. Many times or some of the time, you'll get inconclusive test results, meaning they found something, but not exactly sure if it's the cause of disease. And a genetic counselor would work through all of that information. We're trained to, if we're doing our job correctly, helping patients at a level that they can really understand the information. In addition to kind of helping to interpret the test results, sometimes we will need to work with a family to get other members of the family have that testing done for purposes of interpretation. And then once we do get to a point where it's clear, we can say, yes, we think this is the genetic cause, we'll always let those patients know, is there any sort of trial that they might be eligible for? And also, what kind of support resources are there? So there are many patients in which there actually won't be a trial, but there's still things that you can do, helping with low vision resources, support groups, guide dogs, if that sort of thing is needed for the patient. So we'll kind of work through all of that from the beginning of getting the diagnosis made to the genetic testing to after the genetic testing is done to help patients understand that. There's actually about 50 genetic counselors or so around the world who specialize in ophthalmology. There's many other genetic counselors who maybe just work in a general genetics clinic, and sometimes we'll see patients that are affected with inherited retinal diseases.
That's super. And I think, it's interesting knowing one's genetic, level condition really should be an empowering position for someone. You may not have a trial that's ready at this point, but you having that knowledge really puts you at the forefront, actually, in the driving seat of, any research that comes along as well. And I guess, Ben,
Yes.
what would you say to someone who maybe is kind of umming and erring about getting a genetic test? Is there a message that you would like to give?
Sure. I think what you said, Andy, about getting a genetic diagnosis can be an empowering moment. It often is, and I'm sure Carrie sees that quite a bit. But really, once you get a genetic test, and usually do get a genetic diagnosis, you're really getting on the radar screen of the research community. You're identifying yourself as a certain kind of retinal disease patient. And by being on the radar screen, you're advocating for yourself and letting therapy developers out there know that you're available for a trial or potentially a future treatment. And that's really important. So the test not only benefits the patient in their personal life, but it sends a message to therapy developers that there are people out there who have a specific genetic profile that are available for trials and potentially future treatments.
Yeah, and I think that to me is a really, really crucial point, actually, getting on the radar and empowering yourself to take that step into a community of research that is striving every day across the world in many different geographies to, take this kind of research forward. And by having your genetic kind of diagnosis, you can be part of that community that kind of drive it forward. So, Carrie, are there any myths or misunderstandings that you've come across that kind of you would like to bust at this point in regards to getting a genetic test?
I think a lot of people, it's very important that they understand kind of what the test is and what they can get out of the test. And what I mean by that, as far as we're generally testing for retinal dystrophy, we're testing on a retinal dystrophy panel. So we're not testing you for every condition under the sun. We're not going to be able to tell you if you have cancer or heart disease or any of those conditions. We're really testing for inherited retinal diseases. I have a lot of people who are like, oh, can you tell me what my ancestry is based on that test? Well, if they were looking for that, they could tell you. But just by looking for the inherited retinal diseases, we're not going to be able to tell you if your parents are German or Swedish. You have to look for information on the test in order to find it. So I think there's some people who are like, oh, you're going to know this and know that. Well, not if we're not looking for it. So.
Yeah, no, that's excellent. And Ben, from a Foundation Fighting Blindness perspective, what are the kind of common questions or maybe slight misunderstandings that you hear quite a lot?
Well, I think one of the challenges that we're working to overcome is making the professional community aware of testing availability and that it's available at no cost. If you're at a clinic like Kellogg, where Carrie works, obviously they're very well versed in genetic testing, but there are many private practice eye care professionals in the U.S. who are sort of new to the concept. And we try to help them, as does our genetic testing vendor, but also the patient can help in the process as well. For example, we have collateral that the patient can bring out to the physician in their office to let them know that the physician can order the test. Ultimately, it's very easy to do in our program. It's done online. As we mentioned, it's just a saliva sample. But there's a bit of an educational curve for some of the physicians, especially in private practices.
Yeah, and I think that's a really key point to make, actually. This should be an open discussion, and physicians will also need to learn as well. And actually, by empowering someone to go and talk to their physician about this and maybe the possible nature of getting a genetic test, you begin to open that door for a wider conversation. And that's what gets you into that kind of research community where we are welcoming people with open arms. Please do, if you have a clinical diagnosis, please do try and get a genetic one to really give yourself that empowerment and final confirmation. Well, as we come to a close, I want to come to both my guests for any concluding remarks or comments on the discussion that we've had. So, Carrie, maybe come to you. Any final thoughts?
Yeah. So I think kind of one of the main take-home points that patients should have who might be listening to this is that genetic testing is accessible. I think going back to what we were saying about kind of misconceptions, patients think it's not within their reach to do, be that because they don't have a clinician who can order the testing, be that because they think it's going to be really expensive. There are things in place, such as what Foundation Fighting Blindness has in place as far as genetic testing, that make these things accessible. We've come a long ways in what we can do on a genetic test. And if it was something that testing wasn't done through FFB's program, genetic testing is kind of one of the few things in life that we are seeing that even the larger panels with a greater number of genes, the cost is actually coming down for these. And so it is accessible. It is something that is helpful to patients that they should consider, and it can be done. So I think that's an important thing to always keep in mind. I hear patients struggling with that, getting to a person who can do it, but there's plenty of resources out there to help with that.
Great. And Ben, any concluding remarks?
I think the one thing I would add, and actually what I'm about to talk about, whether it's available to you, whether you have a genetic diagnosis or not, is getting into a patient registry. Because these registries, and the foundation has one called the My Retina Tracker Registry, that's how you're putting your information into an online registry. Ours is very secure. We protect your privacy, but it's, again, another way to get on the radar screen of clinical researchers and therapy developers. So yes, the genetic test, getting that genetic diagnosis has a lot of benefits, but if you can take that extra step and be in a registry, we're sharing your de-identified, your non-personal information with the research community who are looking for clinical trial participants. And even if you're not notified about a clinical trial immediately, researchers and clinicians are going into the site seeing if they can identify a critical mass of patients for maybe a trial in a couple of years. So again, it's another way to get on the radar of the research community and stand up and be counted.
And I think from a company perspective, we're always looking for trial participants with everything that we're trying to kick off clinically. And, it's always hard to find recruits. So, getting on a registry or, having that genetic diagnosis puts you on the map, as Ben said. But with the paradigm shift that's happening in research in the inherited retinal disorders, it's never been more important to be empowered by knowing your genetic diagnosis and what to do with it. If you'd like to know more, please visit the Foundation Fighting Blindness website or the dedicated genetic testing page on our company website at procure.com. This has been empowering the IRD community with knowledge of their genetic diagnosis. I'd like to thank both my guests. Thank you, and thank you very much for listening or watching.
Thank you.